Morning, morning, morning. Good morning. Good morning to you.
Now, infection interventionists, preventionists really play a crucial role in keeping the public safe and healthy. In addition to fighting a global pandemic, the infection prevention and control community is protecting us from surges in healthcare associated infections, measles outbreaks, flu season, and so many other day-to-day infectious battles. I remember thinking during COVID, wouldn't it be wonderful if we could see all these little germs flying around that are on our hands and we're spreading about, but no such luck. So we have some fighters who are working to help us, and it's wonderful to have them with us this morning as we look toward International Infection Prevention Week. Keisha Gustave is here. She's an infection prevention and control officer at the QEH. Also here is Marsah Burton, who is an infection prevention and control nurse. And Rommel Jones has also joined us. He is a hospital infection prevention and control assistant. Again, all at the Queen Elizabeth Hospital. Good morning and welcome.
Good morning. Thank you.
Good to have you with us. And first of all, it's wonderful that we're hearing about the observance of this week. That really is meant to highlight a lot more of the work that you do. So I'm going to start with you, Ms. Gustave. Tell us a little bit about what you do as an infection prevention and control officer. That's a great big title, but on the day-to-day, what is it that your job entails?
Well, technically, I am part of what you say the sergeant of the police of the hospital, and that is exactly what infection prevention and control does. We are the police of healthcare, and with any day-to-day, we look at mitigation strategies. So one of the things that we do is to make sure that all patients are safe, and that is it. So we make sure that persons are washing their hands correctly. We make sure that surgical procedures are sterile techniques. We've governed cleaning and disinfections, and we have a robust educational program.
I'm going to tell you, Nurse Burton, and some people will not admit this. I'm going to be completely honest with you guys today because, I never knew that I had to wash all this till COVID, all this. Like nobody ever told me. So I've been washing my hands incorrectly for, let me not call all the years, for a long time. But all this and the PAM, and I never knew all that until COVID. I mean, it was like really just a lesson all over again. So what are some of the areas that people might not be au fait with that we really should be paying more attention to coming out of COVID and on any average day that you guys have really discovered that you maybe pay more attention to and we really should get on board with it?
Well, we understand that there's a technique, as you were talking about washing your hands, there's a technique to it. And we want persons to observe that technique so that you can decontaminate your hands properly. Because gone are the days you could just stick your hands on the pipe, shake it off, and good to go.
Well, I didn't do that.
So we know that many organisms are spread through contact from your hands. You can infect yourself when you pick up organisms from surfaces, from foods and stuff like that. So we encourage persons to wash their hands properly. So that is always the highlight in infection control. The one main principle that can prevent healthcare associated infections or any infections at all, to be honest. The old adage says, cleanliness is next to godliness. So our hands need to be really clean in order for us to provide adequate care to our patients and prevent healthcare associated infections, which is the main challenge that we have.
All right.
Also, you said coming out of COVID, we still have some cases and persons still have to wear masks. So wearing the mask appropriately and not wearing one mask forever and ever because you don't have to probably change it too often. People don't think that they need to change it too often. We see a lot of dirty masks, people wearing the same mask over and over again, taking off, putting it in their pockets. We still need to dispose of the mask and get clean masks to protect ourselves.
All right, that's most certainly is some wonderful advice Yeah, and the mask thing is real. Let me tell you, boy, it's easy to hook it over the gear shift in the car and be like, I have a mask in here, even though it says disposable. People, let's be completely honest with
It's
each
true.
other. Let's be honest with each other. All right, so for you, Mr. Jones, talk to me about, maybe one of these stark realities that you happened upon in coming into this particular area of the hospital.
Um, so one of those would be, just as you said, hand hygiene. I find as Bajans, we just do a lot of hand signs. When we do a sanitizer, we say clean your hands, and we just ball it up. And then I got into this whole department, and I realized there's way more to this than just hand signs. And the importance of cleaning your hands really, really hits home, and we take it right back to COVID. Because persons would think that COVID was a hoax and it's not real, but on a day-to-day basis, the most things that we use are our hands. And it's important that we keep those very, very, very clean and to limit the spread of infections and stuff. So that's something that is imprinted in my head from COVID for sure.
Yeah, no, I loved Grey's Anatomy, and I obviously did not pay enough attention because in seeing how the doctors used to scrub in, like you must know that you're scrubbing away something if you have to work at cleaning your hands that much and all the way up to the elbows. So I definitely should pay more attention to the doctor's show. Not saying that's all of what happens at the QEH, because we know there was a lot of stuff happening on Grey's Anatomy. But back to what we're talking about, which of course is what we're talking about this week, disease prevention week, infection and disease prevention week. I know that there's a presentation coming up. I'm not sure which of you is well equipped to tell us more about it.
Well, I can tell you a bit about it.
Okay.
In line with the theme for this year, Infection Prevention Control Week, we're celebrating the fundamentals of infection prevention, and it's not just for the month, it's for the whole year. And one of the things that happened to us this year, we would have submitted abstract presentations to IPIC, which is the guru of infection prevention based in Switzerland. And we didn't expect that those abstracts would have been accepted, and they accepted all three of them. And which is a really big achievement for ourselves, as well as the hospital, and for Barbados, because, well, and the Caribbean, because it has never happened before. And we were given that opportunity, supported by the Board of Management of QEH, to go to Switzerland in September to give those presentations. So on Thursday, we're going to be presenting The Road to Geneva, which is an abstract symposium. And we are going to share with our partners at the hospital, our other healthcare teams, basically our presentations, and hoping to foster a new chapter in having yearly abstract symposium, because we wanted to promote best practice. So we have findings, so we now put recommendations to going forward.
Oh, that's truly excellent. And I know, on the international scene, we've been hearing a lot about many of these organisms that have become resistant to treatment, particularly antibiotics and things of that nature. So we really have to be far more mindful, Nurse Burton, about how we approach taking care of ourselves and our surroundings.
Right, so that has been part of the standards now, antimicrobial stewardship and infection control. As you say, globally, we're having challenges with antibiotic resistance. And we, in infection control, we also have the mandate to protect the staff and the patients from getting multi-drug resistant organisms. And it is a reality. We coming out of a big outbreak we had in 2012 for carbapenem resistant Klebsiella pneumoniae. We still struggle with that organism from time to time. And one of the strategies we have to use is, during our surveillance, is to isolate these patients so that it would not spread to other patients. So that is one of the biggest challenges we have in the hospital, preventing transmission of those multi-drug resistant organisms.
All right. So tell me all about your experience in traveling to Switzerland to do this presentation. Again, congratulations.
Thank you.
You know, it is truly an achievement for you to be able to put the hospital, Barbados, and as you said, the region on the map through your research and being able to present to the world. Yeah. So let's hear about your experience.
My experience, it was obviously it was the first thing, and transitioning from being an orderly into a whole different department is mind-boggling. So when I got there, I was like more reserved, like all of these big heads, all of these professionals, and here I am, poor little black boy, sitting amongst these people. And what touched me is there were a few persons who came to my abstract, and they actually went through my abstract with me, and they were asking about our policies back home and how we handle hand hygiene. And my abstract was based on pre and post-COVID compliance and hand hygiene. And there are mechanisms out there that they're using that I hope soon we could implement in our own facility.
Oh, that's excellent. What about you, Ms. Gustave? Tell me about your experience.
Honestly, I was like a child in a candy store.
Wow.
Because as a researcher, one of the things that we have to do is base a lot of our studies on references. And it was a pleasure to be in rooms with persons that I reference in a lot of my studies. And to have, I met Dr. Didier Pitet, which is the hand hygiene guru. And to be in the same space with him, it was like a dream come through. And then to have him to say to me as a practitioner, if you need any assistance with any future research, give me a shout. So that was the highlight of my whole trip, amongst other things, but I think that was the one that I took with me. But if I was to be honest, when we got to Switzerland, I was a little reserved as well too, but being in a room with other professionals, you realize, you know what? You know your stuff. And to have other professionals that are senior or are experts in their field saying to you that you guys are doing a really good job, you're a researcher, excellent research and those kind of things, it takes you, like, you know what? We really are doing a good job, and Barbados is doing a really good job, and Queen Elizabeth Hospital is, and the QH should be really proud to have all three of us at their institution.
I agree. And, you know, we maybe have some of that in common as far as, you know, getting some lashes from the public. But we know there are always good things happening at the institution. So, again, congrats. Your experience, Nurse Burton.
Well, everyone knows that I don't like to travel really. So that 10-hour flight was like, had to tolerate that. But getting there, we were able to network with a lot of other persons. You know, we look for persons of our complexion too. So you get to network with a lot of other persons. There weren't many, I can be honest, I did not see anyone else from any close Caribbean countries, to be honest. Barbados was probably the only Caribbean country represented there. So it felt really good to be representing not only QEH and Barbados, but the Caribbean. But we would have met some other Caribbean persons who would have migrated to the US. And we networked with some of those persons. We were able to listen to a lot of studies that emphasize some of the challenges that we have as well, even though we're lower to middle income country. They still have some of the same challenges that we may face. But technology out there, you know, when it was demonstrated, is extreme. And we were really like to tap into those technological ideas and advances that they have though going forward. But we know it's costly, so
yeah. But it's wonderful, first of all, to be able to share, to have that knowledge, to be able to move forward. Now, did you do three separate
presentations?
So yours was on hand hygiene, generally. Yours was on...
Mine was looking also on hand hygiene, but I look at the training modalities. So with my project, I look at the 1-year training mandatory program, and I compare it with a continuous training program. So I'm looking at the training program for hand hygiene.
What about
to see
Yes.
how effective it is amongst healthcare workers, which one the person has responded better to.
All right, what about you, Nurse Burton?
Mine was about the isolation challenges. We have about 11 rooms on Ward A6, and you have to hand it to the nurses on Ward A6 for all these years managing our isolation facility there. And we have some challenges with isolating patients because of the lower number of rooms that we have. Newer hospitals have wards built with side rooms that can house patients who have infections or multi-drug-resistant organisms, stuff like that on the unit. But we don't have that luxury here. So we have to utilize Ward A6, the back of Ward A6, which is very few rooms to isolate patients. And coming out of my study, it was shown that the most cause for isolation was for diarrheal illnesses. The second thing was the carbapenem-resistant clem that I spoke about earlier. And then probably query TB. You don't know if the person has TB, but those were the three top causes for isolation. So that was my presentation.
Well, and I know research takes time.
Yes.
Certainly when you do presentations, and that's just the beginning. And with research like this, I would imagine that it morphs, it changes, it expands, it grows, it breeds.
Yes.
So you can constantly add to or take away from. So again, congratulations.
Thank you.
Thank you
Very
so much.
proud that you three were able to go and represent the QEH first, Barbados second. Truly made us proud with the work that you're doing at the Queen Elizabeth Hospital. And would like to remind everybody on this International Infection Prevention Week to pay close attention to hand hygiene and remind the little ones as well. It's very important because a lot of the times if there is an outbreak of something happening at the nursery or in the schools, it gets in the homes. So you want to make sure that the little ones are fully equipped on how to wash their thumbs. All that wonderful stuff. That still freaks me out. Like, wash your thumb. I was like, how come I never washed my thumbs, people, until COVID?
Okay.
Yeah, I thought doing this was enough, you know. You would get a little, you used to roll it up, a little bit of action
There's a
going
technique.
on.
There's a
No,
technique
she
to it.
But no,
There's a technique to
you know,
it.
I feel like during COVID, everybody was in tune with the washing, and now it's kind of on the back burner a little bit. So we
Yes.
definitely have to pay more attention. So again, thank you. I wish I could give you the day off as a congratulations. Unfortunately, I can't.
That's right.
But just know that that's in my thoughts. I'm thinking you should have the day off. And that song, Holiday, would be playing in the background all day. But again, thank you so much.
Thank you for
and
having
it's
us.
really wonderful to be able to sit down with you guys and hear what's happening in the corridors and the back rooms and inside of the hospital, because we often think of QEH only as A&E and the wards, and we don't see anything else. So just know that there are hundreds of personnel working behind the scenes to make the Queen Elizabeth Hospital work. And we're congratulating the team from Hospital Infection Prevention and Control this morning for the fantastic work that they're undertaking.
Morning, morning, morning. Good morning. Good morning to you.